Understanding leg weakness after prolonged sitting or sleeping, and the causes and medical terms. If you watch this video to this extent, please click on the subscribe button. Thank you. We will be giving more explanation on causes of leg weakness after sitting or sleeping too long, and we will explain the key nerves that is involved, and we also give explanation on the medical condition that may cause persistent weakness. Then we will also explain the loss of bladder or bowel control that is related to this leg weakness. So let's dive into the information given and understanding of leg weakness. Thank you. Now this is the first picture. Majority of us, when we sit too long, we have difficulty in standing up. We always have difficulty in standing up, and number one, we used to feel numbness or weakness on the thigh, and for majority, and less people used to feel weakness or pain at their lumbar region, or the lumbar to the sacral region at the back, for less people. But majority used to feel numbness and weakness in the thigh, to the feet, to the toe, and inability to lift them up after we sit too long due to wrong position in sitting. So let's take a look at a lot of things we are going to share. Let's move on. Number one thing I would like you to understand, and I would like you to take notice, there's something we know as which is called the sciatic nerve. So this sciatic nerve is a nerve that supplies or that innervates the muscles of the lower limb, especially the posterior aspect of the lower limb, that is at the back, from your gluteal region, this your buttock, to this place, and to the front of your toe. So this nerve is the nerve that innervates it. So why does this nerve so let's move on. So I don't want us to waste much of time on explanation, because we still have a lot of pictures to check. So one thing I want you to understand is, some people might be standing up and they will still be feeling numbness and weakness in their lower limb. When I mean the lower limb, I mean the leg. So, and one thing is that can cause that is herniated disc of the lumbar region. So this herniated disc, you can see that this disc they are normally positioned, but this one is herniated, therefore causing compression to this nerve. So compression of this nerve at this junction might lead to prolonged weakness of the lower limb, that means of the leg. So let's move on. So another thing we have to know is that can cause this is poor blood circulation. Poor blood circulation in the terms of the circulation of poor oxygenated blood to the lower limb, to the leg. So let's move on. So we still have a lot of pictures to explain. So muscle inactiveness, when the muscle is very inactive due to prolonged sitting. When you don't prolong sitting, maybe you are sitting for a very long time, the muscle becomes inactive. You might feel numbness or weakness on the lower limb, on the leg. So these are the muscles that when we are talking about the lower limb, these are the muscles we are actually talking about. We also have the posterior muscles like rectus femoris, vastus lateralis, vastus medialis. We also have muscles like soleus muscle. We have the muscles of the gastrocnemius muscle of the calf, and many more. So let's move on. So inactiveness of this muscle can lead to numbness of the lower limb. So please, if you watch this video to this extent, please click on the subscribe button. Thank you. So this is the lumbosacral plexus. This lumbosacral plexus consists of different nerves that supplies that innervates the pelvic, the visceral organs of the pelvic, the legs, but there is two nerves that actually innervate the lower limbs. So these nerves, they have different origins. So normally from this place to this place, this is what we know as the inguinal ligament, and this nerve passing through this inguinal ligament is the femoris nerve. So why do we call it the femoris nerve? Because the femoris nerve is supplying the lower limb. So this is the femoris nerve, and it originates from the L2. See the origination from L2, L3, and L4. That's the root. And this one we are looking at this side is what we know as the genitofemoral nerve. You can see they are innervating the genital organ. So we also have a nerve that this one passes through the anterior surface of the lower limb, and this one is passing through the posterior surface of the lower limb. And this nerve is known as the sciatic nerve. So this is the longest nerve in the body. So because of the lower limb, it arises from lumbar 4, lumbar 5, sacral 1, sacral 2, sacral 3. So this is the sciatic nerve. So let's move on for more. This is more explanation on it. So this is let me check where is the femoral nerve. This is the femoral nerve. So arising from L2, L3, L4, this is the femoral nerve. It will pass through the inguinal ligament, arising from the anterior superior iliac spine to the pubis. So this is the what's this nerve? I think it's sciatic nerve. So innervating the posterior aspect of the lower limb. So it's arising from the L4, L5, S1, S2, and S3. So let's move on. So any obstruction to this or compression to this nerve. So compression to these nerves will inhibit the transfer of neurons, motor neurons, afferent and motor neurons to the brain. So compression to it will inhibit this communication between these nerves and the brain. Therefore, which can actually lead when it is being compressed too long, it will lead to numbness of the feet. So let's move on. So this is the sciatic nerve. The sciatic nerve is supplying the posterior aspect of the lower limb. So this sciatic nerve is divided into two. We have at this junction of the popliteal fossa. So this popliteal region. So this gives the common peroneal nerves. So when you're talking about common, that means it's divided into two to give us the tibial nerve. This tibial nerve is the one that supplies the tibia. The superficial and the deep supplies the fibula. Then these nerves curve forwards to supply the toe. So let's move on. Once there is obstruction or compression to these nerves, that is what leads to the numbness or weakness of the feet and the inability of you to lift up your leg when you sit too long or when you sleep too long. So this is the sciatic nerve. So what can cause compression to this sciatic nerve? Now, when we sit down too long, there is a particular muscle here which is known as the piriform muscle. This piriform muscle can cause compression to this sciatic nerve. So compression to this sciatic nerve for a very long time, as I've said, is the one that causes numbness and weakness of the feet, of the lower limb. So this one, numbness and weakness of the feet. So not the lower limb entirely, but the one that causes the numbness and weakness of the thigh, that's the femoral nerve. So let's move on. let's move on. This is the sciatic nerve. Also, another thing that can occur is when the sciatic nerve is being damaged. So you might have an accident and you don't know maybe your sciatic nerve is being damaged, but you are feeling weakness on your lower limb. Maybe you don't sit too long, maybe when standing you are feeling numbness on your lower limb. It might lead to damage or damage of the sciatic nerve. So due to the fact that the sciatic nerve has been damaged or being compressed still due to the damage of the pelvic bones where the sciatic nerve is passing. So the pelvic bone where the sciatic nerve is passing might compress the sciatic nerve and might lead to a very long term numbness or weakness of the lower limb or weakness of the feet. So this is the piriformis muscle. So we can see the sciatic nerve passing behind the scrotum. When we sit down, this muscle can compress this nerve and lead to numbness of the feet. And this is the deep peroneal nerve. So which is the branches of the common peroneal nerve. Common peroneal nerve is the continuation of the sciatic nerve. So this deep is the one that comes forward to supply the toe. When you're unable to lift up your toe, some people they will be unable to lift up their toe. They might be feeling numbness or weakness in their toe only. What is the cause? Is the cause that this deep peroneal nerve is being compressed. It's being compressed. So let's move on. Then this is a vein. These are veins. When this vein is also being compressed, it can also lead to numbness of the lower limb. Let's move on. So when the arteries supplying the lower limb is also being compressed, it can also lead to numbness of the lower limb due to the fact that if it is being compressed or inability of this artery to carry oxygenated blood to this and supplies to the muscles of the lower limb, it can lead to numbness or weakness of the limb, which is known as it can lead to sciatic palsy. It can lead to compression and weakness of the limb, and that is ischemia. That is ischemia, not sciatic palsy. So that's ischemia. So let's move on. So this is looking at this, this is the this is the sciatic nerves, lumbosacral nerve. This is the lumbosacral nerve. You can see how they supply the pelvic, then move to the lower limbs, then supplies the visceral organs of the pelvic and the rest. So innervate rather. So this is the piriformis muscle, compressed sciatic nerve. So this is when the sciatic nerve is being compressed when we sit too long. So let's move on. So this is the common peroneal nerve. When this common peroneal nerve is being compressed by the article of this by this bones here. And what bone is this one? This one is the fibula. This is the fibula bone. Right? Is that the fibula bone? Let me check. Yeah, it should be the fibula. So this one should be the tibia. So when it's being compressed by the fibula bone, it can lead to inability to lift up our feet. So inability to lift up our numbness and weakness of the feet. So let's move on. You can see we are still showing this sciatic nerve, and this is being compressed by piriformis muscle. So piriformis muscle, compression of the sciatic nerve. So this common peroneal nerve. Sorry, that one is the fibula. So when it's being compressed by this fibula bone, it can lead to inability to lift up the feet. And sometimes if there is a compression in the deep aspect of the deep branch of this common peroneal nerve, it can also be linked to inability to lift up the toes. So let's move on. So these are our arteries and vein. If they are compressed they can lead to inability to lift up this is sciatic nerve. So let's move on. So we have pelvic fracture. So when you have a pelvic fracture, and the femoral nerve passes through the inguinal canal. So, and in the inguinal ligament passes through the inguinal ligament. So we have the inguinal ligament originates from the anterior superior iliac spine to the pubis. When there is a fracture, so this fracture of this arterial iliac spine or to the pelvic, where this femoral nerve is being passing. So if there is a fracture to it, that leads to compression of this nerve, it can lead to inability or numbness of the thigh, inability of you to raise your thigh, or weakness of the thigh. So let's move on. So, and these are the muscles of the thigh: rectus femoris, fetor. I've talked about, you can check on our other video where we explain about muscle. So the first video on muscle 1, anatomy of the muscle 1. So to understand some buildable and non buildable muscles of the body. So this is the femoral nerve. So the femoral nerve originates from L2, L3, L4. So these are the branches. So it enters and it has different branches. It supplies the rectus femoris, supplies the vastus lateralis, supplies the vastus medialis, supplies the vastus intermedius. So any obstruction to these nerves of these branches of this femoral nerve, maybe from the inguinal ligaments or from anywhere, any obstruction to this will lead to inability and numbness to lift up the thigh. That's about that. So this is the sural nerve, the sciatic nerve supplying the toes. So let's move on. So yeah, this is the common peroneal nerve. So I've been meeting this. So I think you can even identify the common peroneal nerve now. So and you can identify some muscles of the thigh. So know that muscles of the thigh, the big muscles is the rectus femoris, and these muscles, this rectus femoris, this vastus lateralis, vastus medialis, vastus intermedius, they contribute together to give us the quadriceps muscles of the lower limb. So let's move on. I think that's all for that. That's all for obstruction, numbness, weakness of the feet. So if you watch this video to this extent, please click the subscribe button. Thank you. So in future, if you have anything you want to add, we will name it 2, because this one is the 1. So thank you once again.